Andrea, you're on.
Hi, my name is...
No, you're going to have to speak louder.
Loud. Okay.
No, get them closer. Speak louder, please.
Okay, hi. My name is Andrea Churches, and I've been performing this anesthesia-free teeth cleaning for 27 years. I started the practice in California, and I've been here in Melbourne, Australia, not Fox Harbor, but I do this practice. I clean dogs' teeth without the use of anesthesia. And it is a holistic approach to dentistry. All I offer, though, is just the teeth cleaning. I don't do any extractions, or those all get sent to the vet. If there's anything that needs to be sent to a vet for surgical, you know, they need to extract teeth, then that's where they go. So I only do hygiene. So what I do is I wrap a dog, and I have little Reggie here. He's 11, Reginald? He's 11 years old, and he's had some prior extractions a few years ago. He needs a really good thorough clean, so I'm going to actually take my hand tool and I'm going to hand scale every millimeter of every tooth, and the process will take me anywhere from an hour to an hour and a half, and then I'll let him go and he'll shake it off and just go do his day. Yeah, that's it. So do you want to help me take pictures? What I usually do, I do a dental inspection when the client drops off the dog. I do a dental inspection to make sure that there's no need for veterinary, to be referred out to a vet, because some situations, if they need an extraction, they definitely need the anesthetic. But while they're just getting a teeth clean, they do not need an anesthetic. Anyway, so what I'm going to do is Alicia's going to help me take a picture here. So I take 3 photographs, one on each side of the mouth, the left and right, and the front. And then I actually send these photos to the client, and if a vet needs to see whatever's going on, then I send the photos to a vet. Okay, we got one photo. Time to swallow. This is all new for him. He's never had it done. Now, what I try and encourage the clients to do, I do a lot of education as to how to keep the mouth clean. And then what I will do is give them a little demonstration as to how to clean their teeth. I use gauze and coconut oil to clean the teeth. They just wipe their gum line every day with the gauze and coconut oil. That is what I do. So first of all, what I'm going to do is I'm going to give a little wipe with the coconut oil first. I'm going to let him smell it. Oh, good boy. Yeah, good boy. He's licking it. Okay. Now what I'm doing is I'm actually removing any biofilm that's on the surface of the teeth. He's pretty calcified though. The tartar on his teeth, he's got a pretty heavy bacterial load in his mouth. Now after the cleaning is done, he has a really raunchy smell coming out of his mouth. But once the teeth have been cleaned, that odor has been neutralized, coming out of his mouth. Good boy. I always start at the front of the mouth just to get him used to the sensation. Yeah, it's pretty calcified. Good boy, how is that? So he's kind of he's giving me a response of okay, I want to get up. I have him wrapped actually. He's wrapped in a swaddle. What the swaddling does is it brings down their anxiety. They release oxytocin when you swaddle them. So it helps to calm down their nervous system. The more anxious the dog, I think the more they respond to that swaddling. Now, we have a joke about this stuff here. This is the tartar. This is I don't know if you can see this.
Wow.
You see it? That's what I just chunked off of his canine. But he's got much more. We call that petarder chips because they sometimes like to, they'll like, it'll flick onto their tongue and they'll like chew on it sometimes. It's just, yeah. So what I do, I'll also move around, I'm not going to stick on one tooth until that tooth is finished. I'll kind of let him like dictate where I go to an extent. So like if he wants to turn his head to the left, then I'll kind of work on the left side a little bit. And that way he's kind of like getting to call the shots a bit.
And it's not painful?
No, it's not. You may see a little bit of bleeding. Now, what the bleeding is it's inflammation in the gum line. It has nothing to do with an injury or like anything like that. It's just like if we have inflammation in our gum line, and if we rub our gum line, or if we floss or brush our teeth, there may be blood on the toothbrush. So that just means they need more regular. And as soon as I leave the tooth alone, the bleeding will stop. So it's just like a little bit of a, and the heavier the inflammation, the more the blood flow. So like if there's a really red inflamed gum line, then that gum line is going to bleed more profusely as I'm working on it than one that's not as inflamed. There's a big chunk there. You see that?
On the ground.
Bacteria. So I really encourage my client base to come in on a maintenance plan where they come in every 3 months and we redo the teeth cleaning. And then I try and get them to be compliant about like wiping their mouth out like at least once a day. But if they come in every 3 months, like the first time I clean them, it can take up to an hour and a half to clean the teeth. It's all right, buddy. Oh, it's all right. I know, he just wants up right now. It's okay, sweetie. I know. There we go. So that popping you hear, if you can hear it, that's actually the breaking up of the calcification on the bacteria and the calcification on the tooth.
Wow.
It's a big, huge chunk there. It's really big.
Yeah, that's huge.
So with this was actually jammed up right up against his gum line, and it was lifting. It's actually killing back the gum line. And then what happens is that the gum line pulls away from the tooth with the tartar sitting up against the gum line. It just is a dieback process. And then they form a pocket, and the gum line, the bacteria gets into the bone, and that's what periodontal disease is actually the bacteria in the bone of the. So this is just a really slow process to eventual tooth loss. If you don't get the stuff off, it accelerates the need for extraction and the loss of tooth. The loss of need for infection. This is really, really calcified. It's really hard. It's been on here. The longer it sits on the tooth, the harder the calcification gets. So like if he were to come back to me in 3 months and I would do the same cleaning, then this wouldn't be really hard like it is right now. Now when I need to open his mouth, I have a little tool that I'll show you once I get into the inside of his tongue side and the inside. palate. I have a tool that I use to like get him to open his mouth for me. My rule is, and it has to be this way, is that once the dog is wrapped up, I need to like finish the job before I let them up. So they never get to like, you know, say that when they are done. Otherwise, then it just creates it's setting a precedence for the procedure that yeah, it goes smoothly and you finish the job without the dog saying when it's going to be over. It's not over till it's finished. Good boy. Okay, I'm going to stick this in your mouth, okay? Now this is what I call a bibar, but what it is just really a nylon dowel, and I wrap it. So I put this in the dog's mouth, and then this is what they'll chew on it. This chewing is actually a release of, it's like kind of squeezing a stress ball. So I'm going to let him chew on this, and then he'll just all of a sudden just start holding it in his mouth. And we'll pull it out in a second, just depending on how much. Good boy. He chews on it. Good boy. Are they what, sorry?
Easy enough to get the Detox tool?
Yeah, actually, well, you have to go through a dental supply.
Do you do large animals too, like horses?
No, that's a completely different procedure.
Is it okay?
Yeah. Horses' teeth are different than dogs. They constantly, like, continually erupt through the jawbone and the mandible throughout their lives.
They
So
keep growing.
it's not growing actually, it's just they're erupting. Because they actually, their tooth is in their jawbone for like, you know, and then it starts like, as they age,
It's like they get hooks on their teeth.
yeah. So what horse dentistry is it's actually filing down, or not, like grinding down. They grind out, they recalibrate the mandible and the maxilla, and balance the mouth out, because there's certain angles to the molars and stuff. So they actually have they grind the teeth and, you know, recalibrate the mouth to when it was a young foal, that kind of balancing that they do with horses, but they don't do that with dogs, yeah. And horses do get some tartar, but they're not like, that's not their main issue. It's usually, the hooks and the ramps and those things.
They need them floated. They call them floating.
Yeah, well, there's now actually, floating is actually kind of old school,
Is it?
knocking off the points, but now there's more like advanced, like rebalancing of the whole mouth
Yeah.
that they do.
I would imagine. Yeah, it was
Yeah.
12 years ago I had a horse.
So do you work on all sizes of dogs?
I most certainly work on all sizes of dogs. Yeah, now, when I work with a large dog, there's two of us that actually work on the dog. Well, one of us is doing the cleaning, the other one is doing. We lay them on their side. Say we're not wrapping a large dog. We don't wrap a large dog. We only wrap the
Little ones.
little ones are up to like a whippet size. We can wrap. It depends on their weight and how much, because I lift them up, and it just really depends on the awkwardness of actually getting a wrap on them. Yeah.
Alicia, if you see any questions come up, make sure that you go through them so that
This one says, can this be done on cats too?
can it be done on cats?
Yes, it can be done on cats. Cats are a little bit more tricky, and I've worked on cats. What it is with cats, and some people don't want to do cats. That's fine. But cat bites are really highly infectious, and their cats are like volatile. Dogs are a little bit more. They're different personalities. So if somebody wants to work on cats, they can most certainly work on cats. You can probably work on ferrets too.
But you wouldn't work on cats?
No, I choose not to. And it's not because I'm afraid of them. I just know too many people that end up like in hospitalization with like IV antibiotics and bone infections, like joint infections and stuff from cat bites on the hands and stuff. So about 25% of the cats you can't do because of their temperament. They just like blow. They go from 0 to 60 and like kind of thing. So I just don't want the headache of a cat.
What would a typical procedure like this cost?
I charge for like, I call this an initial clean. I charge this, I charge depending on the size of the dog. So so a small dog is $400, and I charge up to $500 for like a Great Dane. So, and they all take about the same amount of time. I just need that second person to help me with a really large dog. That's never been done before. Some of them, after they've had it done, a lot of them, they just come and lay down for me. They're like, oh, okay. They
It
know
doesn't
what's
hurt.
happening. Yeah, it's like, it's okay. And you'll see with him too, like he's panting. This is actually good. This is him releasing his anxiety. He's calm now, actually. He's done resisting in his mind. So that's what the panting is.
I guess it would feel a lot better for them too when they're eating food.
Oh, absolutely. Yeah, absolutely. This is a bacterial load in their body, in their system, and it needs to be removed. It's just as important to have this removed for them as it is for us. And they actually have these really tiny bodies, and this bacterial load in that small body, it's going to take them out quicker than like a human. All right, buddy.
And then there was the question of where do you practice?
I practice out of Burwood Vet in Melbourne, Australia. So it's also known as Burwood Bird and Animal Hospital. I work I'm not part of the hospital. They give me a space within the hospital where I work out of because they support the service. That's such a hard piece there, I know. All right, so
does.
Here's a question. Would you help break down of the calcification and Odysee?
Yes, that's what it's, well, that's I'm removing the calcification on the outside of the Odysee. The calcification is, yeah. It's a biofilm. It's a bacterial colony of all different types of bacteria and minerals, and it actually has a synergistic, like there's actually a synergy that happens with all these different bacteria. There's like waste management systems, and there's all these like it's it's not just bacteria sitting on teeth. It actually is like a city that operates as a city. But yeah, it's quite crazy. So they have 42 teeth in their mouth. Dogs. The adult dogs have 42 teeth. Puppies have 32 teeth. If anybody has any questions, feel free to ask. Good boy. Now that he's panting, I can actually work on some of these teeth in the back without putting a bite bar in his mouth. Good boy. Now this is his first time. He's doing really, really well. Now each time they get it done, they like process it. Like it's like, oh yeah, you know, he's and when he comes back, because Andrew lives in Melbourne, so I'll probably be doing him again. And when I do him next time, he's going to actually be like more compliant with it and understanding of what the process is. And it won't take as long either. The next time I do him, it's going to take like literally less than half the time to do him. It's just that he's so built up this time, and the calcification is so hard that, you know, it's taking me a bit longer. Like the flow of it takes a little bit longer because of the it's all handwork, really.
Yeah. So you do it originally every 3 months. Do you stretch it out from there?
No, I don't. After 3 months, it goes back up to like the full price because it calcifies. So the longer it's sitting on there, then it becomes more work for me. More, you know, yeah. So I just keep it at unless the owner is like really the dog owner is like compliant and wiping their mouth out all the way, every tooth all the way to the back of their mouth, the insides of their mouth, and then they come to me every, you know, like I can work out something. Let's see how compliant that client is doing their homework,
Yeah.
you know, and then I can maybe work something out with them. But otherwise, it's really like it's 3 months,
Yep.
or if they go over 3 months, then it goes back up to full price. That's just yeah.
Okay.
Yeah.
So do you recommend a diet for them at all?
Yes, I do. What you don't want to do is you want to stay away from any bones that are grinding bones. Any bones, because I see a lot of fractured teeth. A lot of teeth that were broken from people giving the wrong types of things to chew on. You don't want to give them anything that they're grinding on, because that grinding action, you can imagine like if you're grinding on like something as hard as a bone, like a femur bone or something, or a rock or something, that your teeth would break, you know. So that's what happens with the dogs, is they get broken teeth. So I see a lot of those. So what you want to do is you want to give bones, I suggest raw meaty bones is the best thing to give. There's a great website that I suggest people go to, and he's a veterinarian actually in Sydney, but he promotes this raw meaty bone diet, and that's really feeding them what canine or carnivores, feeding carnivores what carnivores were intended to eat in nature. Mm-hmm. And the best way of looking at it is like as whole and unprocessed a carcass as possible, of size appropriate nature, of different varieties if you can. But if you can't do that, then I suggest giving like just chicken frames. You know where you go and get those frames of chickens that just are the rib cage and the sternum and the backbone? That's what, uncooked, yeah, you give that. And then let them, and see, those are bones that they're actually able to pop, you know, and like they're able to like, you hear them crunching it like they're crunching kibble, you know, like it pops, you know, like, so you don't want to give them anything that they're grinding on. So hooves, antlers, femur bones, any weight-bearing bones from a large animal. The heavier the animal, the denser and harder the bone. And then what happens is that bone will then, or when they're chewing on that bone, it'll break their teeth. And then that tooth will definitely need a dental surgery done to remove it, because it's like been cracked right through to the roots. So it's very painful. That's a tooth that needs to be removed.
What age do they usually start cracking their bones? I mean, cracking their teeth?
They can crack on a bone. They can crack it on a bone at any age, yeah. Yeah, it's just really the amount of pressure that they put in their mouth, you know, on their...
So what about neck bones?
Neck bones are good because they're not weight-bearing bones. They're not bones, but you don't want to saw any bone with a saw going through them. You want to stay away from any bone that has had a saw go through them. So that also fractures the outside casing of the bone and makes it brittle, so that then they get shards, and then they can swallow those shards. So neck bones are good because there's not a lot of weight, so they can actually break them down.
Big dogs.
Yeah.
Very big dogs.
Yeah, those are good. So yeah, Tom Lonsdale's website is rawmeatybones.com, and that's the veterinarian in Sydney that has this Raw Meaty Bones book, and I really suggest going on there, because it really, dog food or kibble and the processed food is really, you know, like is detrimental to their oral hygiene, you know.
Would that be why dogs very like big chunky bones, big hard bones? Because when they put them in the ground, they sort of cook and they come out a little bit more brittle and chalky.
Yeah. No, I'm not sure. Yeah, that's a bone that's been buried for years. I don't think that would be that would be a really old bone if it's coming out. It's a big bone that comes out of the ground like chalky or.
I remember we had a dead sheep in the paddock, and they'd been lying there. It had died, and we were going to bury it, but couldn't get near it because of the smell. So we left it there, and it sort of just deteriorated away. And the dog was going for a bit of a run around the paddock and grabbed one of these bones, and they were just like chalk. Yeah.
Oh, I'm kind of getting some deeper in your mouth. You'll see after this, like he's gonna, like I said, he's gonna jump up and shake it off and go over and get a drink of water and go lay down on his little bed. He'll be able to eat tonight, and he'll be able to like carry on his life without any recovery time at all. Now, one of the things I do offer is I offer a money-back guarantee on this. So, what I like, if somebody's not satisfied with the work, then yeah, I've never actually had anybody want their money back, and the 27 years I've been doing it. And I've had actually veterinarians actually take, you know, a dog that I finished the cleaning, and they take the dog and they put them under anesthetic because the dog needs some extraction. But I've already done the work, and they check my work, and they're like, wow, yeah, as good or better than as a cleaning as when we do this with the ultrasonic scaler under anesthetic. So
the name of that thing is Romy Tivana?
yeah, Romy Lonsdale. He's got a book. He's got a couple books, but he's got a book on there that's really, really good. And it just really exposes the dog food industry, really.
I'm going to let you keep going. I'm going to bring everybody in, and then we're going to talk about where they're going to be able to see this video, and then we're going to talk about, because some people have questions about what we do for dogs. Okay, so you can
just flip it around.
in a minute.
Okay.
All right, everyone, let's start. Guys, okay. Okay, all right. Just move it over nice. Hey, everybody. Good job. Thank you. All right. We're just getting resettled. And then pull it up first. I'll get the other one.
That one was the right way.
Okay. Okay. All right, so just so everybody knows on here, if you live in Australia, just know that Dr. Sage Wolf, after he finishes the non-surgical course, he's going to be going to Melbourne to give a lecture, and you'll need to get in touch with Andrea, but we will have the lecture details and the training details, because, here, can we not do a roadshow tonight?
I was trying to lift them up higher.
No, that's wrong.
Just
Gotta go
closer.
lower. 1 second, everyone. No, look. There.
All right.
Okay. Bear with us, everyone. Okay. Front.
And then a little closer.
Okay, all right. Okay, so anybody in Australia that if you're interested, so I think it would be like the course starts on this Tuesday, and then it'll be 2 weeks from this Tuesday that he'll head to Melbourne. And then he will be doing a lecture down there. And then if you want, you can book if you want to get non-surgical with Sage. And I think what we'll do here is I will give you his phone number, but we'll try to figure something out here. Let me think here. Maybe, can I have people call you, Andrea? Yeah. Okay. What's your phone number again? 0420. Why don't you come sit beside me? Thanks, love.
Hi.
Here, there you go.
We haven't set a date yet.
No,
for the
but
lecture.
14 days from Tuesday is when he'll get to
maybe
Melbourne.
on a Thursday night, maybe around the 7th, possibly.
Okay,
night.
Thursday night on the 7th. Okay.
And my number's 0420 313
Yeah.
255. So we'll be organising that. We'll get the details out to you as soon as we can.
And then Sage will give Andrea the times that he can do the non-surgical, the costs if you want to come get non-surgical. And then also Andrea will have her cell sonic, right?
Yeah.
So you'll be able to get cell-sonic and non-surgical for those who want both. If you really want to rock your world and you really just want to turn around something that they said was not reversible, or you're on your way to surgery, or you're just tired of suffering and believing that the rest of the practitioners out there know what they're doing, because most natural health practitioners do not understand it's a scar tissue calcification issue, correct?
That's right.
You get that now, right?
Yes,
More than get
definitely.
that. Okay.
So Sage will be doing a personal treatment and training. So he'll be working in the morning, and in the afternoons he'll be able to see people as well for private sessions. So
That's right.
yeah.
Okay. And so now Andrea is still working on the dog, everyone. And just know this, that video that you just saw will be going into the pet guide that we have in the BraveHeart library. We're going to keep adding things that are natural, that are empowering for your pets, okay? And that'll be in the pet guide at on Doc of Detox. But you can go to BHN Library or BraveHeart Nation Library, and you'll find that there. Now, somebody was asking, where's the lady that was asking about her dog? Where is she? Excuse me. You wanted to know about your dog? Can you come in and have a seat? You can stay if you want. Hello? Christine, would you like to come and ask the questions about your dog?
Come in.
Well, just right here so I can hear you. What's going on with your dog? If you're going to stay there and whisper, we can't get it done.
Yeah, come up closer.
Yeah, right here. Nobody can see you. Okay? All right? Okay.
I was wanting to know what we could do to help her not have fits.
What could you do to not have what?
Epileptic fits.
Oh, the dog has epileptic fits. Well, it's just like anybody else. Just know this, that first of all, the person that owns it can't stress out around it. That's the first thing. And just know this, did anybody notice that your pets get your illness? Did you notice when you get depressed, your pets are depressed? When you're up, they're up? So understand, I'm not blaming the owner now. The dog was 3 months old, right? So it might, or 3 years old. How old?
15 months.
So he got it when it was 15 months, or he got it when it was born?
We've only had it 3 months. We don't know what happened.
So he's had it for 3 months, and it's 15 months old. So it was 1 year old prior to, okay, sir. All right, well, just remember this, that the dog is used to something really traumatized it. Yes. So you just need to know that. And then the food would probably be no good because just know this, 99 out of 100 pet owners only feed their dogs Oreo cookies. And people are going, no, they don't. Yes, they do. Kibble is Oreo cookies. Kibble is Oreo cookies. Kibble is Oreo cookies. And then was the dog vaccinated? Okay? And then what drugs has the dog been given? Because dogs get treated just like humans. And veterinarians, 99 out of 100 of them don't know anything about health, about real health. They know about drugs, they know about surgery. Am I right about that, Andrea? Yeah. So don't kid yourself, okay? Don't take your pet to a vet. Take your pet to a natural health person. Believe it or not, that's the truth. You know that. Okay, so if you want to make your dog into a druggie, I mean, what does the dog get fed?
Gets fed twice a day.
What does it get fed? Regular science diet stuff?
There's some raw diet that we're getting and putting veggies and things together and blending it.
So it's a raw diet, so that means it's bone, organ,
It's got that in it.
tissue, but no kibble.
A small amount.
No kibble. How much flour and sugar and drugs would you like your dog to have? Because it's all in the kibble. Just because you and your family like kibble, because that's your crackers, that's your chips, that's your ice cream, okay? That's your donuts, that's your alcohol, that's kibble to a dog. And it'll make a dog sicker than a human really quick. You can't...
And that's why so many dogs get cancer.
Yeah, that's because you feed him Oreo cookies. You can't give, especially a dog that has seizures. Do you think you should give a dog with seizures sugar and flour? A little bit of sugar and flour could set the dog off. So we know that the dog has a mineral problem, don't we? If it has seizures. We know that it has an anxiety problem, right? I would have my dog on magnesium. I'd have my dog on black gold, mixing it with the food. If your son wants to know, he can call. I would have the dog drinking structured water, not just water. Okay, I would have a little bit of black diamond in there so that we can suck up the acid. Because see, the black diamond will go to the brain, but here's the big thing the dog needs. Ocean Essentials and C60. It doesn't have enough essential fatty acids. Its nervous system's blowing out. What?
Doesn't drink normal water.
Well, filtered tap water is good. Tank water, that's good, but structured water is what really heals and hydrates. Structured water will have 1,000% better hydration down to the cellular level and into the nervous system and the brain. And the dog's brain is on fire, or you wouldn't have that problem. So we know that the dog has an anxiety problem, okay? So what you gotta do is if you can calm the dog down long enough and strong enough, can you create a new personality? So nutritionally, we need to alkaline the water and do things like that. So we'd be giving the dog magnesium throughout the day, and it'd be in everything. We put it in the food a little bit. We put it in the food, a little bit in the water. Okay, all right. We make sure the dog is getting lots of essential fatty acids through the MCT coconut oil, C60, and through the Ocean Essentials. Ocean Essentials would be amazing for the dog. It doesn't have enough fatty acids, okay? And check the dog's bowel movements. They could be when you're having seizures, erratic, sporadic, from constipation to diarrhea, I don't know. But if your son wants to call me, we can go through that. But that dog can completely, okay, you can turn a dog's seizures around 10 times faster than a human's. Why? Because the human didn't go to a doctor that said you're gonna have to be on these drugs. You didn't go to a doctor where they said you're going to have these seizures for the rest of your life. See, the dog doesn't play into the BS of that kind of belief system. You can turn it around really quickly, but you got to stop the kibble. And also you got to stop the little bone snacks, okay? Because what's in them? If you want to give the dog rawhide to chew, that's different. Do you understand? So you really got to start looking at what you're doing. But the dog was terrorized, traumatized somehow. Yeah. And the dog replayed the story of trauma. So what the owner has to do too is take a look at when the seizures are, make notes, what was going on prior to the seizures. I'm serious. Now a dog can have seizures enough that it will go, every 3 days I have a seizure. It becomes a program. Nothing triggered it. So then you've got to use things to change the frequency, right? And that would be nutrition. That would be the environment it lives in. You know, if it lives in a stressful environment, if he's on the phone going, blah, 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 or if he has the wrong kind of music going, you know, I'm serious. You know, try to look at the dog as a human because they're very close to it. And then treat them like you treat a human being that you didn't want to have a seizure and you didn't want to wind them up. And then guess what? The dog's not getting proper nutrition. If the dog was getting enough minerals and enough fatty acids. Did you hear what I just said? Minerals and fatty acids, and the main mineral would be magnesium, and enough fatty acids through the MCT C60 and through the Ocean Essentials. You're going to see a big difference. And did you know something? If you put that dog, how much does it weigh? 20 kilo. Okay, so if you were to put that dog on one Vital Care Thunder Shroom, which is not the critical care, but one Vital Care 3 times a day, you will see that within probably about 10 days to 2 weeks, we will have totally flipped his immune system. That's how fast. The Vital Care Thunder Shrooms are 30 years old. The Critical Care are 90 years old. And if you want to see things that'll just blow your mind, these Thunder Shrooms, they have 40 years of research with top doctors and scientists in Asia. These are prescription. Did you get that? okay? And they utilize these all the way from COVID to cancer to depression to every immune disorder for every human being and for their pets. And the whole pet market has exploded with thunder shrooms. Yeah, and people will spend way more money on their pets than they will themselves. So just so you know that. But if he wanted to turn the dog around, he can. He can work with me and tell me, okay, here's the symptoms, here's how the dog's feeling. I mean, if you went on and watched about Emmett, I mean, we have, right now, we probably have, I don't know, probably maybe a few hundred to 1,000 pet owners that are actually treating them with our products. You treat them with our products, they don't get sick. That's it. They don't get sick. Oh, wait a minute, but that's not for, yes it is. All our products are great. And a little bit of daily cleansing tea wouldn't hurt the dog either.
Yeah, well, Reggie used to have anal glands, used to get blocked all the time, and I started him on the daily cleansing tea, so he just has the rest of whatever I've got left over from mine. I pop it in his bowl, and I use the tummy love as well.
How many people have seen
And he doesn't have any more, his anal glands aren't locked anymore.
Yeah, how many people have seen a dog drag its butt along the rug? Okay, well, it's trying to actually create circulation because it's blocked up. And understand this, there would be, ready for this? There would be no pelvic problems in large or small dogs if their bowels were moving and if they had the right essential fatty acids. So just know that. And Reggie, his whole hips were gone. Reggie was losing his, not Reggie, but Emmett was losing all his hair along his back and his spine from scar tissue, because the first 9 years his owner fed him kibble, the best science diet kibble. So anyways, now guess what? Emmett was almost bald. You could see the pink skin, and within 3 months, Emmett has thick hair all over his body of fur, okay, as if he's just a young puppy. And his eyes are bright. And remember, Emmett, okay, 6 weeks ago, when they went to the vet said, don't take him home, you need to put him down. It's done. The cancer's through his liver, through his kidneys, it's over. So now that's 6 weeks, and Emmett's running around like he's a little puppy, because Emmett's taking, believe it or not, Emmett's taking critical care thunder shrooms, 4 times a day, right? And he's on Black Diamond, he's a little bit of Black Gold, he's getting the C60, he's getting the essential minerals, okay? He's doing the Ocean Essentials, and it's like there's nothing wrong with him. Remember something, everything's frequency. And understand something, veterinarians know nothing about dogs' health. The majority of them. That's the truth. I'm not putting them down. I said the majority. Okay? There are some really great vets, boy. But they're few and far between. Okay? Because they're always in trouble with the veterinarian association if they don't sell the drugs, do the surgeries. Because that's all owned by the government that has an internal government that has a chokehold on all of this stuff, because it's all about the drugs. I mean, the science diet, we already know you don't follow the science diet, or you don't follow the science because it's BS, right? Yeah. So the reality is that we're talking about whole food nutrition for pets. Okay? Yeah. And the other thing is if we were to go and work on what kind of dog is it? It's a husky. Okay, if we were to work on the husky and work on going and doing the whole doing the spine, okay, and doing the neck, and then actually doing the abdomen and untying his intestines, it's probably gone already. I go into the back of the neck into right here. We call this the middle eye, where the occiput is. They have it too, it's the same thing. And we go in there and we open up everything, open up the circulation. It's all about flow. It's all about flow. Remember something, what does anxiety do? Anxiety causes inflammation, which causes scar tissue formation, which slows down circulation, causes calcification. Do you see? And then all the way to mutation. Okay? And when he's having a seizure, there's not enough essential minerals going on, enough fatty acids. So he's sparking and he blows a circuit.
Yeah. He's not getting any minerals.
No, he's not getting any minerals. The actual anxiety that was actually caused because there was a trauma in his life. It's true. Just like a human being, you could have a trauma, you go to bed with it, you wake up with it, you're freaked out by it, right? Because you can't let it go. You guys know all about that, right? I'm still trying to get you to let go of your story. I just want to tell my story. No, stop. So, you know, the dog is right. He's like using instinct now. He's on guard because somebody threatened his life somehow. And so he's playing the story. So how can your son make the dog feel safe emotionally, bring up the nutritional value, and keep his bowels moving? And I guarantee his bowels are messed up. They're all tied up. Hey, listen, what's wrong? Oh, I feel like my stomach's tied in knots, okay? I feel like I've got a block, you know? Right? Okay. All right?
Yeah.
Yeah.
He needs some gentle, loving care.
Yeah. So before I sign off, just know this, like I said, Dr. Sage Wolf will be in Melbourne. Get in touch with Andrea. What's your phone number?
0420.
And Andrea's going to come on Facebook and put the phone number on here. But you'll also find her phone number if you go to braveheartnation.com and click on lectures. We'll have that lecture up there within the next 2 or 3 days. And then you can just really harass Andrea all you want. What's your phone number?
0420 313 255.
Okay, and I'll get you to put it up in here too, that they can contact you, right?
Okay, beautiful.
Now, Andrea owns a really beautiful clinic in Melbourne. She's got a Cellsonic. She's getting a cardio bed, okay? And she does non-surgical. She does Perfect Day Consultations. She's our host in Melbourne when we come to do our lectures, especially when we come back again in July, right?
Yes,
Yeah, okay?
You'll be staying with me this time.
Will I really?
Yeah,
Do you think you want that?
yeah, maybe not.
Just Lori.
Yeah, just Laurie.
Just Lori.
Not the
All
gas ass man.
Not the gas ass. I'm the gas ass. Okay, all right. All right, so anyways, I'm going to have to sign off because what I'm going to do to her, I cannot have a video on this.
Is Reggie finished? Is Reggie finished?
Is Reggie finished?
Yes, he's finished.
Okay, here, bring him over here so we can see Reggie. The Reggie video. Okay, here. This is Reggie's before. Take a look. Look at that. Oh my God, does Reggie smoke and do drugs or what? Look at the tartar. Now, does everybody know that this is actually from a bowel problem? Okay, does everybody know that tartar is from a bowel problem? Unless he smokes. And the reality is guess what? It's not gum disease, it's bum disease. And remember, hot air rises and he's got poo particles coming up and clinging to his teeth. Okay? And here, we'll show the other. I'm not staying at your house. She put Reggie up to it. Now look at the difference.
Oh, wow. Beautiful.
Look at that. No drugs. No drugs, you veterinarian.
And that's he hasn't actually been to the vet for about 3 years now because I didn't want him. Every time he'd go, they would.
My phone. And I'll put them
I
up.
have to put him to sleep to do his teeth, and then they'd pull a tooth out. And he hasn't been for about 3 years.
Here, let's get a picture of him. Everybody wants to see Reggie.
Reg?
Reg, here. Reg, show them, Reg. Here, show them, Reg.
Let me see.
Yeah.
Okay.
Well, he sneezed on me.
Here.
I gotta get him back. Can you do mine now? No. No, you're up to something.
Can I give I forgot to give my phone number for work.
Oh, yeah.
No, it's too late. We're on to new video. It's a new video now.
Bye. Bye. Okay.
Okay, so tell them where you live. Come on, closer to me.
yeah.
They got to be able to see you.
Okay.
It's more important they see you than me.
Okay, I live in Melbourne, Australia. If somebody got a group of dogs together, a big enough group of dogs together, me and my team can come up and do the dogs. But
Anywhere in Australia.
yes, it has to be a large enough group of dogs.
Yeah.
You can contact us at Canine Dental Hygiene Services. We're on Facebook. Our phone number is 04 333 48639, or you can reach it, or you can find us on we're on TikTok, Canine Dental Hygiene Services, or Canine Dental Hygiene. We're also on Instagram, Canine Dental Hygiene, and we're also on Facebook, Canine Dental Hygiene Services, and our website is www.caninedental.com.au. I think that's it.
And her name is Andrea.
Andrea.
Okay? All right? We hope you enjoyed the show. Okay? All right? Because this is the way. You know what? Let's stop giving money to the Rockefellers. Could we do that? Could we just do that? Okay. All right. We'll talk to you guys later. Have the best day of your life. 3, 2, 1. We got this.